China continues to report new chikungunya infections in the past week, sparking concern that infected mosquitoes from a lab program may have caused the spread of the infection among Chinese people. Guangdong province reported 1,387 new chikungunya cases in the past week from August 3rd to 9, according to a notice by the Provincial Centers for Disease Control and Prevention. The cumulative number of chikungunya cases in Foshan in Guangdong province, where the first case was reported, had exceeded 6,000 as of July 29th. Chikungunya fever is a viral disease mainly transmitted to humans by mosquitoes, with symptoms similar to those of dengue fever, such as fever, severe joint pain, muscle pain, headache, fatigue, and rash. There is no specific antiviral treatment for chikungunya, and deaths from the disease are rare but do occur, especially among those with underlying health conditions. 90 chikungunya-related deaths were reported in 16 countries as of July 2025. Chikungunya infection has spread to other parts of China, with cases reported in Macau, Beijing in Hebei province, Chongqing in Sichuan province, Wuhan in Hubei province, and Hunan province. Chinese authorities have imposed mandatory PCR testing of blood samples for the chikungunya virus, raising fears that the virus is more widespread than officially reported. The Chinese authorities have a history of underreporting infections. One example was the COVID-19 pandemic. According to WHO, Beijing reported only 122,000 deaths in China, with a population of 1.4 billion people from COVID-19, while the US has only 24% of China's population, or 340 million, but reported more deaths of 1.2 million. The outbreak of the chikungunya virus has sparked concern that infected mosquitoes from a lab program may have caused the spread of the virus. In early August, Chinese state media reported that China's largest mosquito breeding facility in Huangpu district of Guangzhou City, Wolbachia, was conducting a program to mate male mosquitoes infected with Wolbachia bacterium with wild female mosquitoes, aimed at producing eggs in a population control technique known as Wolbachia transinfection. If infected female mosquitoes in the lab are not separated from uninfected ones and released into the wild, they can continue to successfully breed and spread disease. The lab said it developed an automated technology to efficiently separate female infected mosquitoes, but there is an error rate of less than 0.5%. Assistant professor at Feiqian College Sean Lin said an error rate of 0.5% means there are still about 25,000 female mosquitoes that can transmit diseases being released every week. Chinese media reported in May that the pilot study was conducted on 30 million male Wolbachia infected mosquitoes, and 2 months later, China saw the biggest chikungunya outbreak.